Okay, so I think we're going to make a start. Good morning, everybody, and welcome to the launch of the 9th Good Merger Index. My name is Tracy O'Keefe, and I'm the Account Director for Partnerships and Mergers at Eastside People, previously Eastside Primetimers. And we're delighted to welcome you this morning. So Eastside has a reputation as a kind of leading advisor on merger and partnership working in the social sector, and the GMI is an annual piece of research we carry out to shed light on merger activity, and that helps us to inform our work. But we're delighted to be able to share the highlights of that with you today, and we'll be sending on a copy of the report and the slides after the webinar, so you don't need to take copious notes. First of all, a few housekeeping points. The webinar is being recorded and will be available from the Eastside People website after the event. Please use the chat function to ask any questions. You can ask questions anonymously, so please don't hold back. No question is a dumb question. And there'll be an opportunity to ask questions after the initial presentation, at the end of the panel session, etc. But just drop the questions in along the way and we'll do our best to respond to those as appropriate. So on with the webinar. I am joined today by Mike Taylor, my colleague at Eastside, who is the author of the report, and he'll be taking us through the findings shortly, answering any specific questions on the research you'd like to raise at the end of that section. And again, put them in the chat. Following Mike's presentation, there'll be a panel discussion led by Eastside's Chief Executive, Richard Litchfield. He's joined by our sector leaders who will be sharing with you their experience of merger and wider partnership working. So we're delighted to be able to welcome Graham Hodge, who is the Chief Executive of All We Can and Y-Care International, Stuart Marks, who's the Chief Executive of Rennie Grove Peace Hospice Care, and Duncan Shrubsole, who is the Director of Policy, Partnerships and Communications at Lloyds Bank Foundation. So thank you all very much for joining us and sharing your experience with us this morning. So, but before we get into the report and the presentation of what we found, we thought we'd ask you a quick question. So we just want you to think about what you think we've seen in the second year of COVID. You may know that last year we saw, which covered the kind of first year of the pandemic, we saw quite a steep rise in merger activity, particularly amongst smaller organisations. This report covers the second year, and we wondered what you think might have happened during that period. So, Mike, do you want to share with us the question? And people can give us a sense of what they might think. Thank you. Mike will share with us the results when it's in. Okay, brilliant. So 60% think that the activity will have increased, 27% think that it will have stabilised, and 13% think it will have reduced. So yeah, so let's see what our report actually showed. So Mike, would you like to share with us what we've actually seen?
Hello, welcome to the Good Merger Index 2021 to 22 launch. I'm going to give us a high-level overview of the information we found about that year. I'll start with a little bit of history. We've been carrying out the GMI for 9 years now, and that gives us a very good baseline of information that we can use to compare one year to all the others. It's worth bearing in mind that the year in question is the second year of COVID. Of course, still enduring lockdowns, a lot of financial uncertainty, and of course a very difficult operating environment and an uncertain future overall for organisations. Just to talk a little bit about our methodology. There is a Charity Commission register of mergers. But of course, that only includes charities, and we also look for mergers in the social sector more widely. It only lists mergers where one organisation has closed completely and its assets have been absorbed by a receiving charity. We're very reliant on when an organisation chooses to register its merger. Some may take several years. And the register provides little insight into what's behind those mergers or how they were undertaken. And the last thing to say is it includes a great many reorganisations where linked charities might be consolidated into one, or where a charity may simply change from being a company limited by guarantee to a CIO. So to say a bit more about our methodology, we use a charity year that runs from May to April rather than April to March, which allows us to report much sooner on the bulk of activity, because that does take place in April of each year. We do use the Charity Commission register. We also look at the news and other public announcements. We use charity websites, other organisation websites, trustee annual reports, and the accounts of organisations overall. We remove reorganisations and administrative changes, as mentioned earlier. We include charities and social enterprises. And we include a merger when we think it is meaningfully complete. And in the absence of a completion date from the Charity Commission, we'll make a judgment about when that is. We also have our own definitions for mergers and merger types, so you may want to read the report for more information on that. But most mergers are takeovers, followed by mergers of equals. So what did we find when we looked at 2021 to 2022? What we found is a significant fall in merger activity, which surprised me, at least in terms of how large that fall is. We found 51 mergers involving 103 organisations. That's the lowest level activity on record for us by both measures. The previous trend of an increasing level of activity amongst smaller organisations has appeared to have come to an abrupt end. And in fact, when we look at the types of organisations involved, we find indeed that it is smaller organisations again that have driven this change. The level of activity in organisations greater than £1 million turnover has not changed dramatically now for 4 years, although it is perhaps still lower than previous times. It's smaller organisations where we've seen this big fall in activity. If we look at how the types of mergers have changed, well, corresponding with a reduction in the number of mergers, we've also seen a marked reduction in the number of takeovers and in mergers of equals, those being the most common forms. But mergers of equals are now at their lowest level ever, and takeovers are now the highest proportion of merger than they've ever been. Subsidiary model is a little bit higher, but it's important to recognise that we're talking about few mergers of this type anyway, so whether or not it's significant is hard to say, but it is a marked drop, at least when looked at on this chart. If we talk a bit about finances of organisations, we're interested in two things here. We're interested to understand the volume of activity that has been transferred, and we use income as a measure of that. Assets are not reported by all organisations, and we don't feel assets report a level of activity within organisations as well as income does. We're also interested to understand how financial stress may drive mergers, because we've tended to find that financial stress has been a provocation for organisations to seek takeover by another. Something I want to emphasise at this point is when we look at finances, we look at the year before the merger year. And this is because a lot of unusual financial activity can take place within the merger year. And this means we're looking at the finance of organisations in the first year of COVID, 2020 to 2021. So what do we find? We find no great change in either the value of activity in mergers involved, value of activity in organisations involved in merger, or in the value of activity transferred in merger. Now, we may have expected to see this fall further due to the overall reduction in merger activity. But that reduction in activity is amongst smaller organisations, and the larger organisations skew these figures significantly. And of course, we haven't seen a great deal of change there. So it's perhaps not as surprising to see that these figures in this chart have not changed so much. However, there is something quite interesting in this next chart. In this chart, the blue bar represents the proportion of receiving organisations that are in surplus, and the yellow bar represents the proportion of transferring organisations in deficit. We've found that financial stress has been a driver for merger, and we see that typically organisations transferring their activity to another tend to be more often than not in deficit in the year before merger. But this year we find that they're not, and as I mentioned earlier, this is the first year of COVID, 2020 to 2021. So that, I think, is quite interesting. So to summarise, we're looking at the lowest level of merger activity on record. That's over 9 years. This is driven by a significant fall in activity amongst smaller organisations, with no large change in the level of activity amongst larger organisations. Takeovers and mergers of equals have fallen the most, unsurprising, although takeovers are now the highest proportion that they've ever been. Financial performance of organisations involved in merger appears to look relatively good, and that's performance in the year of COVID 2020 to 2021. So it's really hard to say for certain whether COVID has been a factor in all of this, but perhaps it has. And I'm going to finish here and let the panellists tell us what they think about what we found. Thanks very much for listening.
Thanks, Mike. Can I just jump in, because we've just had a question about how we define subsidiary mergers. So, Mike, do you want to just? This is in the report, but it'd be interesting just to pick that up, I think, before people get a chance to read it.
Yes, it's explained in the report. We've got 5 different types of merger classification that we use. They're not official, other than the fact that we've been using that form of classification for the duration of time, the years that we've been running the index. But by subsidiary, we mean that a subsidiary organisation retains its legal self-entity. Its assets aren't fully absorbed into a parent, but so it retains its legal independence, but the parent has control over it. The other thing you'd find with the subsidiary is that it retains its branding as well.
So the other question we had was, did we look at closures, the number of closures alongside this? So did the decline kind of relate to the fact that if they'd been in deficit, they may have closed instead of merged?
Sorry, can you repeat that?
So the question was, did you look at the number of charity not-for-profit closures alongside this? Did merger activity decline because smaller charities who may have been in deficit closed instead? So they kind of went down, but I think the net position was not different, was it?
No, there hasn't been the thing is, with 170,000+ organisations, when we look at mergers, we're looking at a very small subset of those. Overall, when you look at 170,000 charities, there's not been a massive change in the number, although there appears to be a bit of a slowdown in formations. We've not analysed closures, and I think part of the problem is you could look at a big number and not really understand exactly what it's saying. You'd have to analyse it in more depth to really understand what's going on there.
Thank you. I think that was all in the chat at the minute, Richard, if you want to.
Great, thanks, Tracy. Yeah, and hello everybody. Good morning. I get the very enjoyable job of leading the next bit of the event and discussing more of the qualitative stuff with our panelists. And as Tracy was saying, we're joined by Stuart and Graham, who have both led mergers or strategic partnerships, and we're joined by Duncan from Lloyds Bank Foundation to give us a funder's perspective. But I think I'm going to start off, if I can, by just asking the panelists for a quick kind of opening reaction to what we've just heard from Mike about some of the findings from last year. So I suppose if there's something that jumps out for you as either that either feels like it rings true to your own experience, or perhaps the opposite, something that particularly doesn't chime, be interested to get your thoughts on that. Who would like to kick us off? Graham.
Sure. I mean, thanks very much for having me this morning. I think the thing that stood out for me really was around the low number and the sort of unprecedented low number. And since I kind of first read through the report, I guess that's something that I've been scratching my head about. Why is that? Why is it that the number is so low? And I think probably, I guess basing it on my own experience and maybe projecting that into the context of the conversation, I wonder if it's just something that it doesn't occur to people that actually that's a possibility, that sadly within the charity sector far too often we kind of, are just so focused on doing what we do that we don't often think about sort of that reaching out aspect. There are some really good examples, don't get me wrong, where people are working in partnership and across multiple organizations. But I wonder, especially if you're a smaller NGO or charity, that actually whether that just it occurring to you that actually this might be an option, and then having the kind of chutzpah to be able to go and actually raise that with somebody else, at risk of offending or worrying or kind of creating some sort of conflict, I think perhaps maybe could be a deciding factor. But I do think that's really interesting, whatever the rationale or the reason is for why the number's so low. Yeah, thanks, Graham. Stuart, Duncan, would you like to? Stuart.
Yeah, thanks. I think that the number of decreases is also very interesting, like Graham has said. I wonder whether that, though, is just a lag from a COVID year where people were actually focused on something else, and there's been a bit of a gap. So it'll be very interesting to see next year whether that number increases back to previous levels or not. What I also thought was really interesting in it is the number of takeovers has increased. And a couple of things that made me think around that I thought were worth considering and thinking about. Were they about a rescue situation because of a COVID year or not? Were they just easier to do for people? Because actually a takeover is much easier than a merger of equals or getting everybody on the same page. And then I wondered also whether some of the organizations who were willing to be taken over were really just about tired of existing. 2020 COVID year was blooming hard work for everybody. But I wondered also whether anything in the health and social care sector were the smaller organizations who were willing to say, actually, my time is finished now, and actually I want to be taken over by somebody else.
Thanks, Stuart. Duncan, what's your take?
Thanks, Richard. So I'm Duncan from Lloyds Bank Foundation for England and Wales, and our focus is funding small and local charities tackling disadvantage. We support about 600 at any one time. I have to say that we start maybe sort of agnostic about merger, and we think that sometimes the debate about merger is driven by a view which is either bigger is best, or even sometimes, there's too many small charities. And actually we think there's a fundamental importance of a good locally rooted small charity that understands its community and works and responds to that community. But having said that, we provide funding, but we also provide a range of capacity building support. And we fundamentally believe that trustees should always be thinking about what's the best way of delivering their mission. And so sometimes that means they should think about certainly collaboration, but sometimes merger too. So we do provide within our capacity building program support for charities who do want to consider merger. And actually our findings, I've checked with the team, and our findings back up yours, that they've seen a drop-off in charities requesting merger support over the last year. So there's about 4 that we're aware of at the moment that are contemplating or progressing. They're usually in the mergers of 2 smalls, like a couple of mines or a couple of addiction charities, but there's definitely been a drop-off. And I think I would back up some of what Stuart was saying. I think 2021-22 was a particular year. There was some more emergency money that had been around during COVID, and that had kind of helped people, not just in that first year, but in that second year. That's obviously now gone, and people are really facing big challenges from cost of living, from other things. And I think but the problem is they're quite tired and exhausted and kind of being very much focused on the front line. And as your colleagues will say, merger takes time and effort. And I think where people have been trying to keep navigate through cost of living, change their services. If a trustee jumps up and says, "Hey, let's think about merger," I think there's quite a few exec teams who would say, we're just too tired at the moment, or we're too busy in the day job." So I think that's something that's worth exploring as to whether that's going on. But as I'll pick up later, I certainly think people are collaborating more than ever, even if formal merger numbers have dropped off.
Well, no, thanks, Duncan. That's really interesting, and really interesting to hear that the inquiries that your colleagues are picking up has also kind of dropped in around the merger support. So I suppose actually just a little bit of housekeeping to say, we can see some questions coming in around the chat. So please, that's great. Keep going with those. We'll do our best to feed those back to panelists in a moment, but also there's a chance we won't get through all of them, but we'll respond after the event to try and answer as many as we can. I wanted to just maybe delve a little bit deeper on some of the things that just came out there, and particularly to ask, I suppose this is for Graham and Stuart, but in terms of your own situations, was COVID a kind of driver? Did it the fact that just great uncertainty that we were all kind of dealing with, did that kind of accelerate your mergers, or the opposite perhaps? Stuart, would you like to pick up that one?
I think certainly in 2020, when my organisation started to think about it probably very seriously, there was an element of a drive of actually, we're both in exactly the same situation. We're both hospice charities. We're both in patches that align with each other and rub up against each other, if you like. So we were thinking, actually, is there too many of us? And we were also, I think everybody was thinking, what will this look like in 12 months' time? So that was a question behind us, but actually for us, the main driver for us thinking about it was opportunity. And it was opportunity in the situation, and changes within one organisation led to us thinking, actually, why not now? And we had been collaborating on a number of things and thinking about that beforehand. And so we continued to work with collaboration, but really opened up the merger. So COVID had an impact, yes, but not as much as actually this is just potentially the right thing to do, and the right time to consider it.
Thanks, Stuart. And Graham, what was your perspective?
Yeah, I can honestly say I don't think COVID actually played a massive part, really, amazingly, in our decision to merge. It certainly wasn't something that was discussed as a factor or a driving force, and I don't think could even necessarily be attributed to one of the reasons why, for example, the other one of the parties, YCare, decided to join. So I think there was, of course, a net effect across both charities on the way that we work. But actually, I think certainly from one side of the equation, from the All We Can perspective, we'd found that actually COVID had in some ways increased our efficiencies and our ability to kind of get some things done. A lot of things couldn't, but some things done in a more efficient way. And perhaps even within the context of the coming together of the two charities, there was actually an efficiency that was gained as a result of the restrictions and the largely online meetings and transactions that we were doing, that perhaps maybe, you know, rather than having to find lots of times for dates for meetings and things like that, actually some of those things I think probably moved faster as a result of COVID rather than slower.
Okay, thanks guys. Yeah, that's interesting. So it sounds like it had some impact, but wasn't a significant impact for either of you. So I believe we've got drum roll, a second poll coming up now for our guests, and we're keen to just get a little bit of the temperature in the room for why you think the reduction of mergers has been visible through that 21-22 years. So if you'd like to have a go at this, multiple choice, I believe, and you can put as many factors down as you like. Here, but it'd be interesting to see what everyone in the room thinks about that same question. Why did mergers reduce in the last year? Okay, so here we go. Hopefully everyone can see this. So the main view is that there was more focus on immediate operational priorities, which had an impact. And also coming in second there was that organisations perhaps were unclear about their post-COVID strategy. Great, thank you. So I'm just going to take us now into a little bit more depth about understanding both the mergers that Stuart and Graham have been involved in. So Stuart, can I come to you first and really perhaps ask you the question, if you could maybe give us a bit more background on the Rennie Grove Peace merger. I know that there's been a number of mergers in recent years in the hospice sector. So it'd be kind of really interesting, I think, just to hear what your thinking is behind that, and particularly, I suppose, telling our guests more about the rationale to bring your two organisations together, please.
Sure, I'm grateful for the opportunity to do so, because I think it's a very interesting and wonderful learning experience to go through something like this, both professionally and personally. So Rennie Grove, a hospice charity in Buckinghamshire and Northwest Hertfordshire, are in the process of merging with Peace Hospice Care, hospice charity based in around Watford, Three Rivers, in the north part of in the southern part of Hertfordshire. West. This all started in 2020 for us and was mainly driven by opportunity. The chief executive of Peace Hospice Care managed to get himself another job in the middle of COVID, and I thought at that time, and he thought at that time, that these are the opportunities and situations where conversations like this could really take place. The sector, led by Hospice UK, was also going through a real question about what is the future of hospice care and what is the future vision of the sector. So there was a big report in 2020 which mainly focused on how do you collaborate together, would you consider about mergers? So the sector was already really thinking about this for us. We'd also been collaborating as two organisations on some things. We did a joint service that was commissioned, and actually some of those things were not straightforward or easy. So a conversation continued with how we should collaborate, and also should we consider merger. So during the tail end of 2020 and the beginning of 2021, trustees of both organisations came together, formed a small group with the chief executives, and started to look at what were the potential reasons to believe that a merger of our two organisations would be a good thing. We came up with 5 key topics, and we had a shared charitable purpose and vision. Tick, good idea. We all wanted to increase our services. Wouldn't we be better off doing that together? We needed to access more funding. Wouldn't it be better if there was less people asking for funding from commissioners? And also we wanted to grow our organisations. Both felt that to move forward, more resources would need to be put into the organisation. So why not bring two together? Because you've already got a much larger team to be able to deliver your objective. There was also the idea that we should try and, as much as possible, reduce duplication of work that was going on in the health and social care sector in our area. And in turn, would that perhaps mean that we might reduce costs? So serious reasons to believe about what we were doing this. And once we'd got them together, we then decided to start looking properly at a due diligence process. And we did that across the board, but we ran it privately. We believed within our trustees and our executive of the organisations. We had good members of staff who knew what they were doing. And we decided to do our privately run due diligence process, which ran through the first half of 2021. During that period, what also happened was a lot of trust was built by two groups of trustees and two organisations, as well as with the executives. And by the time we got to the end of the fourth quarter, if you like, of the year 2021, we'd really begun to think about this seriously, and we then decided that we needed to bring in some expert help. We brought in some legal work to make sure that we were looking at memorandums and articles properly and what we might do and which merger process we might follow. And we also brought in some clinical expertise about what a joint team might look like. And we also brought in Eastside People to help us pull together the right project plan and development of what was required and get us in the right order. And by the end of that year, at away days in both organisations, trustees approved moving forward to plan properly for merger. During 2022, the very early part of it, we created a joint shadow board. So teams of trustees from both organisations who would want to go into a future organisation came together as a board. We appointed myself as the designate chief executive and the designate executives to join an internal senior management board. We also then managed to get approval from the trustees in March of 2022 that this was what we were going to do. And then we announced in June that it was our intention to merge later that year. Slight added point of this is that Rennie Grove was a membership organisation, and of course to change its memo articles and to join up with another organisation to move into a third, and we decided that we would create a top company and a top charity of which we would both be subsidiaries of. We needed to be able to get members' approval to change the memo arts of Rennie Grove to be able to move forward to have only one member, and that member of course being the new organisation. That took a lot of real conversation with members, persuading them that this was the right thing to do. And I think actually the fact that we had just come out of an uncertain COVID year was a help in that. 96% of those members who voted in favour of it. So that was a real win for us, and I was really pleased that that happened. Since then, we've made the announcement, we've come together as organisations. One of the things that's held us back a little bit between October 2020 and now was our Charity Commission approval. It took us 5 months to get that, but luckily it came through at the end of last month. We're really in the early stages of integration. We don't think our merger is over. We think it's a long haul, and we're integrating two organisations together into forming the new one, Rennie Grove piece. Things that I think were really good was that everybody thought that this was a good idea. They're now thinking, oh my goodness, this is hard work. But actually, it's good fun in the main. I do recognise enormously, though, there are quite a few members of our organisations who are quite anxious about what the future may be. And the focus now for our organisation is about reassurance, building trust, and making sure that any communications that we have about our merger are heard in the way that we intend them to be, not necessarily in the way that people first hear them. Thanks.
Good, thanks. Yeah, no, that's great. I mean, thank you for just walking us through that. And there's so many kind of different aspects of that would be lovely to pick up with you. But I suppose in the interest of time, I'm just going to encourage all, I guess, if they've got questions for Stuart, please put them in the chat. There's certainly lots, I'm sure, about integration there that jumped out to me as being fascinating. I think I'm going to just restrict my follow-up question, Stuart, just to one thing, which is, I think you said that everybody thought this was a good idea, or at least, you know, seemed to now. Now, I suppose we see quite a few situations. I'm going to kind of take you back much earlier in the journey, at the point when two organisations are starting to talk. And sometimes trustees will say, I think quite reasonably, how do we know it's this organisation? Why is it this organisation rather than another organisation that's, that we should be partnering with, or we should be merging with? And I was just keen to ask you, I suppose, whether that came up and what you had to do and what work you had to do to kind of validate that it's Peace, isn't it? As you were on the Ready Grow side, that Peace was the right organisation to do this with.
And for me, I think that question did come up, actually, not quite in that specific a way, but it certainly was a factor. I think initially both boards of trustees were, why would we need to? But they had recognised that there were a lot of hospices in the sector, and the Hospice UK transformation programme really did focus our minds on, actually, these are the things that we need to consider, and merging and working together and collaborating and all those other things are forefront of all that. There was also a couple of experiences pre-COVID where hospices had to close because of lack of funding. And our trustees were very keen on making sure that services to patients were at the forefront of what we wanted to do, and the securing of that service for the long term was really important. Yeah. I think we also begun to really just be open about stuff, and that helped too.
Yeah, great, Stuart. Thank you so much. I'm going to move us on and ask Graham to come into the conversation now. And Graham, I think it'd be great. Well, the same kind of question. If you could kind of walk us all through some of the background for your particular merger, or I think you prefer to call it a strategic partnership, which I think is going to be very interesting for everybody. I think I've seen in the chat there's already some comments which a sense that strategic partnerships are perhaps things that people are particularly focused on right now. And I think it would just be great if you could walk us through the background to it, and particularly, I suppose, particularly focus on the model that you have chosen to adopt, please.
Yeah, sure. So I think for us, our story is really quite a short one in many ways. I guess the conversation to even begin contemplating this began in February 2021. But prior to that, in 2020, as an organization, All We Can, which I was the CEO of at that time, was looking at our 5-year strategy and finalizing our 5-year strategy. And I remember during that process, the consultants that were helping us with that process were really quite, I would even go so far as to say pushy, to sort of say, have you thought about mergers? Have you, even if you're not planning one, have you thought about it? And I guess we were quite kind of pushy in terms of our response, and sort of saying, no, it's not really something we're looking for, and this is what we're focused on. So it wasn't something that we put into our strategy. It wasn't something that we were looking for. But in February 2021, I was sort of messaged on a Zoom call. I was on a sector Zoom call, and had a conversation with the then acting CEO of YCare. All We Can is a international development and relief charity. We are the relief and development charity for the Methodist Church in Britain, but also work with a variety of others, and we serve all without discrimination. Then we have YCare, which is the relief and development agency for the 4 nations of the UK, the YMCA in the 4 nations of the UK, and also the Republic of Ireland. And also, again, works throughout the world, particularly with YMCA partners in over 120 countries where they exist. So we had kind of 2 entities here, and one CEO contacting another in a message to sort of say, hey, can we chat? And that was really brought about because prior to that, 2 years prior to that contact in February 2021, I had gone and shared a little bit about our partnership approach with YCare International. And that's quite a significant focus for us as an organization in the All We Can side, because it was something that was different to what was happening in the sector, but it was an area that YCare was wanting to move towards. we had the conversations, we shared lots of resources, nothing really kind of happened up until this contact in February 2021. And we were just sharing as CEOs really a kind of our COVID journey. How's it been during COVID? How's it been for you as an organization? And it was fair to say that actually on the Y-Care side of things, that actually things weren't that rosy. They weren't, they'd kind of been through some real kind of strategic struggles. They'd also had some significant funding cuts as a result of government cuts in the sector, and I guess perhaps a heavy reliance on institutional funding in that sense. And you know, so they weren't in a particularly great place from that point of view, but equally they weren't by any means in a place that wasn't recoverable. I didn't feel anyway. It was after that that I kind of started to stew on the idea of, okay, what would it look like actually if we joined together? And so we chatted as a senior leadership team at the All We Can side of things, came back to Carolyn with a follow-up conversation. And in that conversation, we both agreed, hey, let's look at this. This could be, you know, a really great opportunity for both of us. And so that was in the February of 2021. And by literally midnight on the 31st of August, 1st of September, we were signing the agreement, and from that point onwards became a sort of a combined organization. I think that in saying we became a combined organization, I think it's important to clarify what the model is that we evolved throughout that. We became pretty quickly sort of keen on the idea that actually subsuming one charity into the other was not a model that we wanted to do. A lot of that was driven by our ethos around partnership. And I think also by the acknowledgement that there were two families here, two very strong families. We have a, you know, UK and a global Methodist family, and we had a UK and Ireland and a global YMCA family. And actually both of those were very, very strong networks and families that we were bringing to the table. So straight away, it was more like a marriage rather than a kind of a takeover in that sense. And so we started to look at, okay, what is the operating model that we could work on that would actually make this effective? If we believe that there is still plenty of potential left in Y-Care that just needs to be kind of reactivated and reimagined, on that side, things were going well with All We Can, but you know, Y-Care we needed to do some work on. If we believe that there's still plenty of potential there, what does that look like as an operating model? And we decided that actually acquiring them in a takeover sense was not going to be an effective way to do that, that we wouldn't realize real potential, that there are people who are on that journey of support and solidarity with that movement and the change that it had made in the past that actually just wouldn't come across. There's no reason why they would suddenly develop an affinity to All We Can. And so we were looking around for models within the charity sector, and even to this day, so I'm very interested if people on the call, or I know we've had conversations with Mike as well, actually, is there a model like this in the charity sector that is working this way? And we couldn't find any. There may be some, but it's actually quite common in the commercial sector. And so, you know, rather than seeing, you know, the commercial as the great evil of the world, actually, there's a lot that we could learn from the models that are operating there. And so we developed a kind of operating model that we call One Kitchen, Two Brands. And that was really off of a bit of a light bulb moment. Many people would be familiar with the Italian restaurant chain Zizzi's, and also possibly the Italian street food chain Coco di Mama. Well, what's that got to do with us? Well, during lockdown, Zizzi's transitioned all of their food production very easily to a delivery network and was able to deliver to people without any issue or hassle. Coco di Mama couldn't do the same. And Coco di Mama is actually owned by Zizzi's. And so what they did was they pulled the production of their food into the Zizzi's kitchen. So the same chefs in the Zizzi's kitchens prepare Zizzi's food when people order that, and it goes out in Zizzi's packaging, and they order Coco di Mama and prepare Coco di Mama food, and that goes out in Coco di Mama packaging for people. And so we're like, right, that's quite an interesting model actually, because we're both doing Italian food here, we're both doing international development. There is a nuance about what we're doing. Y-Care is more focused on youth-led solutions, All We Can a sort of wider community perspective, but that's quite complementary. But there is a specific difference to the way that we engage in those supporter bases and those families. And so operating that model, we as one team support both the charitable objectives of those two charities. We're all employed officially and legally by All We Can, but we are all within our job descriptions tasked with working half and half for both of those charity brands and ensuring that those movements are sustained. So that was the model that we went to, and that was possible because of the fact that at the very heart of all of this, the driving force was that we wanted to have a greater impact on poverty and injustice around the world. And we felt that this was a way that actually we could have a greater impact. We also felt that the values base that we were sharing were actually very, very similar, and that we were both faith-based charities also helped in that sense. And so throughout that negotiation, that driving force of, okay, this is a better way for us to have a bigger impact on a really important thing in our world that needs challenging. And actually our values drive us to collaboration, and our commitment to the partnership model that we felt, if we believe in this partnership model, then we should embody it also in even the way that we work and operate as well.
Yeah. Graham, thanks so much for explaining that. I feel like there's a challenge to Mike at our place now to expand our 5 models to include one kitchen, 2 brands. Is that the?
Yeah, I think we're copywriting the phrase, so we'll be in touch with that about the licensing.
Yeah.
But that's fine.
I feel like I just want to kind of clarify a few things. So just let's make sure that we all understand what's going on here. So I think you've said that the leadership team is shared, and I believe the governance or the trustees are, am I right? It's the same group of trustees, are the same on both sides. I think that also begs a couple of questions. What isn't involved. So, for example, was there any legal changes? So, typically, I think we've already said in this event that a subsidiary model is one where typically the parent organisation will become the sole member of the other organisation. So, I guess there's a question there. Was there any legal kind of changes to either of your constitutions?
The short answer is yes, and I can see a couple of questions in the chat about this as well. So looking under the hood a little bit of how this actually works legally, both charities remain legally registered charities in their own rights. So we prepare 2 sets of accounts at end of year, we do 2 reports, etc. It's just the general day-to-day operational functions that are shared. All employees are employed by All We Can, and effectively what happened at point of partnering was that the trustees of YCare signed into action, as part of the changes in their legal constitution, signed into action a collaboration agreement. And that collaboration agreement effectively says that they outsource, in a legal sense, the function of fulfilling the charitable objectives of YCare to All We Can. So legally, all of that sits on that side, but we do have legally 2 boards. So we have a board of trustees for both All We Can and YCare, but in practice, all of the trustees of All We Can are also trustees of YCare International. And on YCare International, we have 3 additional trustee representatives who are the representatives of the YMCA in England and Wales, Scotland and Ireland. We have shared board meetings in that sense, but we're very clear in our agenda, in our decision making. Okay, this is about YCare International, and so those who have the legal obligation, the legal right to vote on different decisions, etc., vote in that manner. Likewise with All We Can, when we're approving trustees' reports, for example, we're very clear about, okay, all in favour for All We Can, and we're looking at those things in that way. So it sounds a lot more complicated than it actually is, because in practice it is actually quite smooth. I can see Duncan going, this is a nightmare, but actually administratively, it really actually isn't in practice when it comes to it. And I think there's various ways. So things like accounts, for example, on a monthly basis, we produce a consolidated accounts for both charities, but we're still keeping accounts of both of those and submit those in registered. So there is genuine savings with time and operations, and that especially comes with our public engagement and our programmatic work as well.
Yeah, no, thanks. And just for clarity, in terms of the constitution of YCare, did that change at all?
There were some changes to the constitution of YK. Yes, there had to be, because of the nature of it. Previously, there was, for example, a veto power for YMCAs over any decisions. So 4 members of that board, for example, could make decisions that were different to that of the rest of the board. So that changed so that there was a more equal board structure. So there were things like that that changed as well.
Yeah, thanks so much. No, that's great, Graham. I can see some questions coming into the chat as well. So I think what we're going to do is maybe we'll just park the conversation there for the moment, but we'll come back and pick up some guest Q&A in a moment to ask you. And so moving on, Duncan, can I bring you into the conversation and to give us the funders' perspective here on, well, you can take this, whether you want to talk to mergers or strategic partnerships or one kitchen, 2 brands, but if you can maybe, I think everyone find it useful to understand a bit more about the role that an organisation like Lloyds Bank will play in relation to supporting mergers or partnerships.
Yeah, thanks, Richard. I wasn't expecting to be salivating about Italian food at 10:23 in the morning. I'm now thinking, Zizzi's, Coco de Mala. And as a sidetrack, we're an independent charitable foundation, but we're funded by the profits of Lloyds Banking Group. And those people may not know that Lloyds Banking Group includes not just the Lloyds brand, but also Halifax, Bank of Scotland, Scottish Widows, MBNA and various others. But interestingly, what they would do is they say they want front product differentiation for different markets and different price points, but back office integration. And I could see, if I was talking to my Lloyds colleagues, the idea that you'd still run separate boards and trustee meetings, and I think they would be one of my board members is the legal director at Lloyds Banking Group. I think she'd be holding her head going, so really interested, Graham, on how that plays out. Anyway, that's a sidetrack. I'm going to pick up a couple of things, role of funders, but also want to reflect on where and how mergers can be done well, and then also thinking about the alternative, which is collaboration, which actually is what many people are thinking about. So, and I said, bring the perspective, we support 600 frontline small and local charities with a turnover between 25k and $1 million. But I also, I'm chair of trustees myself of a small charity. I've been a trustee of a Citizens Advice, which was a merger of 3, but an incomplete merger. So it didn't get the benefit.
Which one are you chairing at the moment?
So I'm chair of trustees of a charity called Switchback, which works support people leaving prison. And I was a trustee of East End CAB for 7 years, a few years back, where it had merged 3 local CABs. I've seen this has come up in the chat, quite common, but it kept 3 separate directors. So it was sort of worst of all worlds. It was a merger that hadn't properly merged. And I think that issue about the merging of federated charities, we also get it, is a really interesting one. How do you do it to get it right? Geography is a really key consideration, because you want to get, and so often people come together around contracts. You want to fit a geographical area that makes sense for what funding provision is out there, and you can do it well. But sometimes what ends up is the charity is not quite big enough still for some of those contracts, but has lost some of its local rootedness. So it's really important that you kind of retain that geographical connection. Finally, by way of introduction, I also want to share, I was also a board member for some time of a housing association, which started as a local community-focused organisation and went through merger after merger after merger, each one getting progressively worse and bigger and badder and more remote. And it was an abject disaster for residents. So I think the housing association sector is a sector where there's a lot of salutary lessons that need to be taken account of about how to do merger well. So how do you do merger well? I think I'm going to just pick up a couple of things. In your report, you mentioned one example, which is crisis and pathway. I think it's in the table. It's like number 19. I must declare an interest. I worked for Crisis for 9 years before I joined the foundation. I had no involvement in this merger, but I did know both organizations, Crisis and Pathway, before. And when I was at Crisis, we also, during that time, merged with a couple of other organizations, one of which was called Off the Streets and Into Work. And I think the example, this is a larger charity in terms of Crisis, which has absorbed over time several smaller ones. And to pick up several of Stuart's points, I think in terms of kind of what leads to success, values, really important. And that the smaller organization sees something in the larger organization, but crucially that the larger organization openly values what they gain from the smaller organization, that they see that this is an organization which has got expertise that we don't, and they commit to that expertise. So when I was at Crisis, people came from the small organization and got key roles in the new one, not just to keep them happy, but actually we can learn something. You actually come over and take over this bit of service so we can learn from it. The Crisis Pathway merger, as I understand it, they've kept their separate board as Pathway in order to keep that focus. And I think that's a really interesting model. I think you have to sort the fundamentals early. Who's the CEO going to be? What's happening to trustees? Because otherwise that can really get in the way. But I think you also have to really understand the financial and operating context. So are there synergies? Are you not competing for contracts? Is there unrestricted money that can help? Are there savings on the back office? And fundamentally, by coming together, as in the hospice example, and actually in the YK example, can you better help the people you're trying to serve? So for Crisis, it was homeless people, through combining on services and influencing. And I think the real challenge on all discussions is there's lots of technicalities, but you've always got to keep in mind that kind of what's the end benefit. These aren't present in all circumstances, but they can be. I think there has been some really good rationalization of medical charities, which similarly points to where you can get synergies and better better end goals. So you look at the breast cancer charities, brain tumor charities, Asthma UK and British Lung Foundation. And I think someone's asked a question in the chat. I think post-COVID challenges on fundraising, so those medical charities which did lots of kind of challenge events and bucket collections and all those kind of things, which have sort of dropped off, and as cost of living people cancel direct debits, I think you're going to see a lot more of those rationalizations, which is potentially a good thing, because when you're facing challenging medical conditions, there are genuine economies of scale in terms of running helplines, doing research, advocacy, and the raising and spending of funds. But even when those stars do align, as it were, that it's hard work and time consuming, and you need that kind of spare capacity.
So I'm going to just jump in. Can I just say, I thought those 3 or 4 points, particularly about the what makes a good merger, I thought were gold dust, and a lot would resonate with us. I've just got one eye on the clock, so I'm going to ask you, do you want to talk about the collaboration?
Yes, that's what I just got to say. So for us, fundamentally, if you want to tackle domestic abuse, supporting a South Asian community in Rochdale, you need to have a charity which is rooted in that community and really understands and can relate to the people you're trying to support. And so that's why we are wanting to encourage collaboration. We working in places, bringing people together with other charities and statutory partners. We're already doing that in 6 communities, and we're looking at a program to support other areas to come forward to look at how to provide some capacity to help the collaborative process for people coming together, actually in this instance around advocacy and influencing that wider environment rather than service delivery. But we hope that it will help lead to a strengthening of relationships generally. We've been involved in a number of collaborations. It takes time, but I think what's a thing that's really important here is thinking through the role of the larger charity, so that they're seen as partners, not predators, collaborators, not competitors. And the leaders of those larger charities really need to show that it matters. And I think we are seeing that. Sarah Hughes at Mine, Polly Neat at Shelter, Mark Russell at Children's Society, all key leaders who are actively saying that collective impact matters now more than individual cause over organisation. So to steward the charity sector as a whole, I think that's a really important thing to do, and to look out for that sector. Just to finish, because I'm conscious of time, I just want to talk about one specific example about something which was the Small Charities Coalition, which some of you may know of, where there was an active debate as to whether they should have merged earlier, maybe with FSI or somebody else. But about a year and a half ago, they realised that they're in financial and other difficulties, and that they wanted to, in effect, it needed to orderly wind up, but they wanted to safeguard and transfer some key assets, which was a helpline that they ran for small charities, and some other best practice material they gathered. Now, what they did was a really good thing to do, and this could apply to to mergers in other instances as well, is that they actively started talking to people early, saying, look, this is the situation that we're in. We want to move forward. They talked to us as funders and said, look, this is what we want to do. And we helped facilitate the process. We funded a consultant who helped them think through the options, and also brought together a mixed group of other infrastructure bodies. So NCBO, NAVCA, CFG, DSC, and then ran a process whereby to really identify what it was that was needed, we wanted to retain and protect, and what it was that we didn't need to, and actually ran a kind of competition as to who could be the, people pitched to be the organization that took on these assets, so that it was, there was an openness to that. And then as funders, we also put, so the helpline is transferred into NCBO, but we provided some guarantees in terms of transferring some funding, but other discussions to make sure that this asset, the benefits of integrating into NCBO could be achieved, but that it wasn't gobbled up and so there's a distinct identity and a distinctiveness, which is the helpline had been really effective at supporting very small charities who were kind of volunteer led and helping and talking to them in ways that they understood. And so therefore we've helped kind of safeguard, not quite a merger, but a sort of transfer of good assets. So to finish, I think, we all need to, mergers have a really important role to play for some. And this work by EP is always helpful in order to not just track the trends, but show the different models, because it's the nuts and bolts that make it work or fail. But we should all be thinking about collaboration, about mission over organization, about the different ways that we can work together. If times are tough, that we can kind of bring assets together and maximize the impact for those that we serve.
Thanks, Duncan. Yeah, that's great. Thank you so much for that, and to Stuart and Graham as well. And there's so much in what you were just saying, particularly Duncan, that we're echo there as well. Certainly, early conversations. I think your example at the end with small charity coalition, and I really liked the emphasis you were placing on the larger organisation. And again, that's something that really resonates a lot. And you were naming and praising, so I'm going to name and praise someone too, which the chap called Simon Antropos, who's now the chief executive of BBC Children in Need. And when he was at Daction, they did a number of mergers, and one of those was with a drug and alcohol provider called KCA. That was a small organisation, and I remember him being very, very committed throughout the whole process to the larger organisation, appreciating and valuing what KCA were bringing, and actually it ended up being his leadership team, I think, ended up being largely made up of the KCA colleagues a number of years down the line, which I think was a great kind of commendation of that approach. Sadly, we're running out of time, and I can see the chat that's just bubbling along. So I really want us to open that up and make sure that we get some of these questions answered. Tracy, can I ask you to come in, and I think we probably want to take batches of 2 or 3 at a time, and then
well, I think if you forgive me cutting across you, I think some of the questions we've covered, some of it, so I think if we kind of can group, but I think one of the things where you've all talked about which would be interesting to get all of your views, I think, is whether it's a collaboration, whether it's a partnership, whether it's a merger, there's always the issue of that innate passion that each organisation, we work in the charity sector or the not-for-profit sector, everybody's very passionate about their own cause. And I think, one of the questions we had in advance of the session actually was, how do you handle the passion of those for their established charities, for their loved ones that you're kind of bringing together, and how you break through those barriers in whatever form the collaboration takes. It would be interesting to hear from it's the cultural piece, isn't it? And I think, Stuart, you're right in the middle of this, aren't you? So maybe that's a good place to start, but how, some tips to get through that, I suppose.
The cultural situation is one that I on reflection thought would be much easier than it actually is. And I thought it would be really easier because we actually are delivering very similar services, and we're delivering very similar services in a very similar geographical area, very close to each other. What I think is interesting and and it has landed in our organization is perception and not reality. And I think being able to really be clear and open and honest with colleagues is really important. And a bit I said earlier on about it's not what you say or what you think you're wanting to try and convey, but have they actually heard what the message is? And I'm beginning to reflect that people haven't heard that as much as I could. And then there is an element of there are different styles of different leaders in an organization. And as an executive board team, so the senior managers, those employed by us, and my colleagues on the executive board have now come together to work particularly on culture and make sure that we as a board are having a conversation which is developing what we're calling our leadership story. Why is it that we're here? What is it that we're trying to achieve? And how do we get everybody else to come with us? And that piece of work is now just started at the beginning of February, and we hope to launch that out to colleagues in March, and then track that over the rest of this calendar year with the intention that by December 2023, everybody will really understand what's going on.
Thanks, Stuart. Tracy, I'm just going to pick up a part of that question and maybe ask Duncan about it. So I think Stuart, you picked up the cultural part of that question. I think a bit of it was also about when you have smaller, well, I suppose size isn't even that relevant, but when you have organisations that have been founded perhaps as benevolent charities or because of perhaps a death in the family, and that there's a certain kind of legacy that is being created and established, and then further down the line that charity then becomes unviable. How does it feel like there's an extra level there or layer there of I guess personal ties to that original charity? And I suppose, how have you seen, Duncan, from a funder's point of view, examples of where then a founder has stepped away as they've tried to create a more viable organisation through partnerships or mergers?
So it's a good question, and I think some of these challenges are not unique to mergers. So even if you're in a big organization and you combine teams, or you have take on a new office, that whole sort of sense of what's going on over there, or you spend too much time with them and all the rest of it, I think, as Stuart says, I think you kind of have to bend over backwards to kind of reassure and show by your body, your presence and the time you spend and the interest you play, that the kind of team that feels the smaller one being gobbled up, as it were, isn't. And then you have to really build a new kind of culture above the two identities. I think the question about organization, I mean, founders, you know, we support a lot of charities that have had founders, and the charity I chair, we've just recruited a new CEO after the founder moving on after 14 years. So this isn't quite in the kind of merger territory, but I think you have to be really careful about how you plot that through, and you have to be about building something new and a new vision, not concentrate on what's lost. So actually, if this is coming to a new organization, we can build something bigger and stronger and more effective. I think just on the medical, this is not a Lloyds Bank Foundation perspective specifically, because we don't really do medical research, but I think the issue about kind of one of the things to do about people setting up something in someone's memory is actually do a better job at not meaning so many charities are necessarily set up in the first place around someone's memory specifically. And I use it an example, Brain Tumor Charity, which is a charity close to my heart. They have a model where you can set up a named fund as a family and fundraise for them and have a discussion about how the money is used, but the back office is all run by the Brain Tumor Charity. And so you can run your fundraising events, you can be branded, and as your money goes, you know, the interest initially when someone's sadly passed away or something is high, and then maybe it tails off, but you don't have any of the costs of running that organization. So it gives you the best of distinct identity, maximizing impact and minimizing resource costs. And I think that model could happen more in other causes. And that means that that would be a better model for the charity sector as a whole.
Sounds a neat model.
Can I, Richard, can I pick up Graham into this? Because there was a specific sort of questions a little bit further back in the chat around the culture under your model, Graham, and actually, you know, are you building one culture, two cultures? or sustaining two cultures, and a specific around were the teams from YCare TUPE'd across, or how did all of that work? But I suppose more the cultural emphasis around this question.
Yeah, the simple answer is yes, absolutely. We're one culture, and yes, all of the staff from YCare were TUPE'd across. I hasten to add that there were only 5 staff when we kind of finally came to that. They had previously been in around about 27 staff. They had sort of gone down to about 5 staff, so there wasn't a huge number of staff. But it's nonetheless, I think we were still very conscious and remain very conscious of the fact that perhaps for staff, it's the hardest journey as well with this, because for supporters, we felt it was too big a mountain to climb, and we understood that that would not be a mountain that they wanted to climb anyway, to actually come and align their affiliation or their passion for a cause to a different name or charity. So we kind of left that one alone. For the partners that we exist to serve around the world in majority world countries, I think for those ones there was an initial hesitation, but actually we had conversations with them, and actually since that point they've seen the real benefit of having new members within their networks as well. So that's been a real positive. But I think for staff, I would really resonate with what Stuart was saying. Actually, I think I think if there's a mistake that I've made, it's probably underestimating how clear we were. I thought we were very, very clear, but I think repeating that message over and over and involving people in that message. And I think, there's some staff who would even feel that they should have been consulted even more as to whether or not we actually made the decision in the first place. I would probably disagree with that in some ways, in that actually I think there's a space where that decision needs to be made. But we did bring them in a month before any deal was signed, where it was looking likely, but certainly not by any stretch, confirmed, and sort of said, okay, how do you feel about that? This is the news, etc. And kind of did do that as early as we could under non-disclosure agreements, of course. But I think even that process from that, seed, there's probably some things that actually we still haven't done brilliantly over the course of the time, and that we're still working on and manifesting now. And I think it is about revisiting that. I think one thing that I've really underestimated with staff and the culture piece, particularly, is that we created an additional 9 new roles. So everyone kept their roles, everyone kept their jobs. And anyone that was TUPE'd came in at a similar level. I'm not talking about salaries and things like that. That obviously remain as protected, but came in at a similar level. So we did a restructure, but we added capacity beneath, made people into managers as opposed to put in a new manager above them, if that makes sense. And so I think that was a really key part of saying, okay, we don't expect you just to sort of double your workload all of a sudden without any extra capacity. Anywhere where that is, we need to add capacity to support you in the role that you're trying to do. So I think that was really, really key. But what I've underestimated, I think, is the extent to which people who have joined the organization since we did this strategic partnership actually still need that cause, and there's almost an assumption, well, they're joining us as one kitchen, so they'll get it when we explain it to them. But actually what I found is that just as much for them as for those that were on the journey, they need that kind of reassurance. We need to kind of keep talking about that, and we need to keep redefining and building culture. And I think the final thing I would just add to that is, when we started the conversation, when we first broke it to the All We Can team, for example, where things were going really, really well, they were sort of like, well, why would you do this? We're on a good thing here. Why would you do this? And there was not a backlash, but there was a kind of a questioning, and sort of, do we really need to get involved with this? On the YCare side of things, there'd actually been enormous uncertainty for about 2 years. So they were kind of like, great, we've got stability, we've got certainty now. But I think as it's kind of panned out over the last year or so, actually, probably there's a real hybrid of all of those things across the team. And that's the thing that I think, you really can't underestimate. It is really, really important. And absolutely, we've made mistakes along the way, but I think we've also done some really good stuff too with the team. And I think the majority of people would say that as well. And our team are a fantastic and very skilled team who are doing a really good job at something that's not a very common way of working in the sector as well. Yeah.
Thanks, Graham. So I guess the other kind of, I'm trying to group the questions a little bit in terms of themes. And I think the other theme, which Chris has just dropped something in the chat about, is about the kind of internal and external resourcing of this process, be that to some extent, whether that's a merger or a strategic partnership. In our experience, you know, they'll not be dissimilar, because this is something that's not central to the core operation, and it's that drawdown. So Lev asked about kind of the funding of the process specifically, kind of, was it internally resourced, externally funded? You know, how supportive, how easy is it to get hold of grants to support this kind of working? And I guess kind of the reflections on what you need to think about internally as a team around actually allocating time, resource, effort, space to the process. I mean, Duncan can perhaps, I mean, he's mentioned the support you offer. There was also a sort of subset for you, Duncan, around at the end, perhaps around, do you actually act as an introducer in effect? If you're seeing this, people coming to you and you're actually seeing, you know, people who are interested, do you forge connections as well as perhaps provide funding? But perhaps starting, Stuart, I mean, just reflecting on, I think everything at Rennie Grove piece was self-funded in effect, wasn't it, from within? So maybe you could talk a bit about that and your own experience of the drawdown on management time and that type of thing.
Yes, thank you. Yeah, we've funded this from both organisations committing the same amount of money into a pot to spend on merge and integration work. We've also committed some money to strategic planning work for the next year or two. And we were able to do that because we had the resources to do it. There are other examples in the hospice sector where they've gone to commissioners to say, could we have some funding? And commissioners did fund another process at one point with other organisations, but with our commissioner, they were claiming they didn't have any money to support. So that's a fairly normal reaction, I think, in the health and social care or the health NHS sector of funding. What we struggled with a lot was the question about how much extra resource we needed. We did all of this from our own internal resources, except for bringing in those consultants I mentioned earlier on, including Eastside People. And what I think was really helpful about that is it helped us get some experience of people who'd really been through this sort of process before and helped guide us and helped answer some questions based on what their experiences were. It was easier for us to bring in that consultant level from EP in that kind of block period of time, as opposed to having somebody with us all the time. And we considered quite often, did we need a project manager to project manage this? And the struggle with doing that and bringing in somebody external is you then have a lot of energy to make sure that that individual understands the organizations in which they're dealing with. And we felt that actually coordinating it through our existing directors would be more helpful. And so we split our work up into planning a kind of master schedule of all the things that we needed to do and identifying the person who was then responsible for making that happen. That was on top of what we were already doing and running 2 organisations and a merger process and delivering care to patients. So it's not been easy. There's been a lot of extra hours and a lot of extra thought, but I'm not sure we would have wanted to do it any differently. And our trustees were extremely supportive in whatever it is that we needed to be able to make that happen. And the effort that was put in by the executive, but also by the trustees. Our trustees were really behind all of this. And their expertise helped us understand that we could do this internally from the majority of point. But it's not easy to do your job plus a merger. And I think one then needs to start forgiving oneself for maybe not doing things on the schedule that you first imagined, because actually it's not like flicking a switch. The legal parts of it might be, although it took us 5 months, but you know, those things could be fairly straightforward. But
just on that last point, were your trustees kind of on board and accepting that those timelines that they might usually expect wouldn't necessarily be achieved?
Yes, every time that
that's important, isn't it? You need other people around you to, you know, kind of have similar expectations, I suppose.
Yeah. When we started this in 2020, we had a target date of merging by the 1st of April 2022. Right. Very quickly that moved to July, very quickly that moved to October, and we're still in the process. So, you know, and we've not two-paid or moved people up into our new organisation yet. That's all still to come. And the timings of that, we need to get it right rather than done. So there's a real focus on making sure that we do things properly and not just because we decided to pick a date out of the air and have that as a target. We need a focus, but actually if it needs to move because we need to get it right, that is the most important thing.
Yeah, okay. I think we've got time. Thanks, Stuart. We've got time, I think, just to finish off this resourcing question. So perhaps Graham and then Duncan.
Yeah, we set aside a budget for that, which was approved by the board. We were fortunate that we had kind of fairly healthy reserves in that sense, and a surplus that we could allocate towards that. Likewise, YCare did also. They had fairly healthy reserves and some operating budget that they could put towards it. So I think most of the costs for us on both sides was really around legals. And the budget was exceeded, as is inevitably the case. Legals always cost more than you think they're going to cost. So I think that was probably the one cost that we had. We didn't bring any external facilitators in our case. We were actually very focused on a deadline of August the 31st as being the date kind of everything needs to be finalized. So it would start on September the 1st because that coincides with the financial year for us. And so just the simplicity of that from an accounting and a kind of reporting perspective was a lot simpler. So that actually focused the mind quite considerably when we first had the conversation back in February. And then we decided to do that sort of late March. We, that kind of said, okay, right, by August 31st, we need to get this done. So that drove the lawyers a little bit mad sometimes, but that was the focused point. And I think it also helped that on our side, our director of finance, who has been with the All We Can organization, had been involved in many mergers and acquisitions in the commercial world prior. So he had good knowledge and understanding of that. And on the YCare side, the then acting CEO, she also had good experience within the charity sector of other mergers as well. So there was some good experience on both sides. Both of us had a subcommittee of the board, which then was assigned to be a kind of flexible and tasked with the authority to sort of make quick decisions on things that needed to be made. But there were lots of other conversations that happened with all sorts of different stakeholders. But I think the momentum and the dates kind of gave us a driving force for that. And I think it's easier as well because we were two small organizations in that sense. So there was a lot less perhaps than other contexts to look at. But yeah, that's how we resourced it effectively internally with a relatively modest amount of money, to be honest, in terms of legal costs. But of course, there is the time cost, and I think that's the critical thing for us that focused us on that deadline, was the fact that we don't want this to take us away from our core activity for a long period of time. If this is going to work, or if it's not going to work, we want it to be a sort of relatively short period of time that's going to distract us from that.
Thank you. And Duncan.
Yeah, so I think the headline is it's not easy, and I can't promise there aren't pots of money out there you can go to support mergers. I think the first thing to do is talk to your existing funders and talk to them early and say what you're wanting to do, so that they can and the positive case for it, and they might well enable you to kind of repurpose money or use it for different ways. They might have capacity building support you can draw on, because third-party support can be really helpful. I think another thing that's really important is really understand the accounts of the charities that are merging. So often people don't actually really understand the cost base, what's funded by what contract, what their liabilities are, pension liabilities, particularly if you've got employees that may have transferred over from a local authority in the past or something like that, can be a real challenge. So really knowing that. It will be difficult, it will take time. And as we go right back to the beginning, time is not something people have at the moment. So that is a real challenge. You might need to kind of add some trustees or, to your board or draw on some others to help you. And finally, though, but I think, if you're collaborating with a range of people, if you were doing like Stuart was saying, working closely with a comparable charity anyway, the more you're working with others, A, you'll be delivering better now, but B, it means that if you do need to look for merger partners, you've got better knowledge of who to do so, the personalities, the values, the overlaps, the issues that might become a difficulty. So collaborate. It's great now, and if you do end up merging in the future, it will ease the path to doing so. Thanks.
Thanks, Duncan. Great, thank you so much, everybody. I could happily carry on talking about this for the rest of the day, but we do need to draw to a close. Tracy, can I hand this back to you?
Yeah, so thanks, Richard. Well, I mean, it's just up to me really to say a huge thank you to our panelists, to Stuart, Graham and Duncan. Thanks so much for joining us and such a rich conversation. As we say, we could be here all day, but we can't be here all day. To Mike for authoring the report and helping us. So we will send out a copy of the report to you and the slides, and I think we'll have an evaluation survey, so please feedback. We always like to improve. We do run a series of quarterly workshops around mergers and strategic partnerships, which Duncan will be thrilled about, because I agree we need it to be a broader discussion. So you should be on our mailing list if you're at this webinar, but if you're not, then please register an interest through the website. And finally, if anything from today, we haven't answered a question, we'll try. I think we've scooped up most of them actually in these thematics. But we'll review that and come back to you if we haven't. And but I'm always here if you want to have an individual call about anything that's cropped up for you as individual organisations. It's great learning for me to hear about what's going on out there as well. So we will also, I think, Mike, there was a closing slide. I think if you could pop that up, because it's got my email address, and it's also got a link, I hope, to the Good Merger Guide. If not, it's on our website. That's quite good reading. If you haven't seen it, it's a good starting point. I think Stuart graciously said that you actually did read the guide, and it was helpful. So he might be verifying that for you. But thank you so much for joining us this morning. I'm going to put my email address in the chat because I don't think we've got the last slide, Mike, have we? So I'm just going to pop that now in here, and then you will have that before you disappear. It is, I have to remember this now because it is Eastside People, otherwise I get shot by the boss. So anyway, I think that's, yeah, okay, great. So do email if I can help with anything, but thank you again, all of you, and have a good day.
Thank you.
Thanks, everybody.
Thank you
So much. Thanks, guys. Really interesting discussion. Thanks for your time,
Yeah.
Stuart, Graham and Duncan.
Thanks, everyone.
Yeah, thanks.